If you're looking for some specific feedback on a specific product feature, after talking to 6 or 7 people, you sort of get the gist. The way we see ourselves is we want to be a healthcare solution for people who are interested in being proactive about their health, which means eventually we're adding more products and services. Working at YC, you see, like I said, so many people succeed in so many different ways that you tend to be less judgy. And so you more look at, what habits do they have, how obsessive they are about talking to users and working smart and not breaking down when bad things happen.
Great. Adora, it's good to see you. I've been before getting into YC, I was looking at your content since you're a YC partner then. And I was religiously looking at your content. So I'm pretty excited to do this discussion together. You have been running Instalab for a while. It's been pretty secret, I would say. I wouldn't be able to find a lot of information online. The more details I could find was from your latest podcast with Jessica. So why don't we start with that? Like, how did you get the idea about Instalab and how did you start?
Yeah, so we're not very good at social media yet, or we don't do paid marketing, but hopefully we'll get on top of that very soon. The idea of Instalab, the genesis of it was basically after my last startup. After that ended, I know I had done a lot of damage to my health. Like I just didn't pay attention to it. I was overweight and I had a bunch of issues, inflammation, and just skin issues and stuff like that. And so I made it a pact with myself before I start my next thing to really focus on my health, which led me into a deep dive into, what I should be testing for, what I should be looking out for, what am I at risk for, what are my genetic risks in particular. And so when I get really, I'm one of those people that will spend a whole day in Wikipedia because I just keep researching and keep reading. So I spent many months just figuring all that stuff out. And then after that, I figured, okay, now I'm going to start on my journey. I'm going to actually do this testing. I'm going to fix myself, do all the things I need to do. And, obviously, before you start doing a new diet or new anything, you probably should understand where you're at currently. So you get a baseline of where you're at. So there are all these tests that I wanted to take. And they weren't outrageous or like super expensive things to do. They were, just things I thought that were normal in the literature and, was saying that these are good, highly sensitive, highly specific markers that I should be getting. And it turns out, and I think a lot of people have run into this, is that when you go ask your physician for these tests, they say you're too young or you're not sick enough or, like insurance is not going to cover it. And so they sort of refuse it. You sort of have to really beg them to let you get those tests done for them to write that lab requisition. And I thought a pretty forward-thinking physician, but it took me 6-7 months until they finally wrote me that one lab requisition. And I got the test done, and it turns out it was just red everywhere. I was just not in a good place. So my ApoB was really high and LP little a and all these sorts of things. But it took me that long to understand how unhealthy I actually was. And then on top of that, it's, my physician wasn't very good at explaining the results to me. In fact, at one point, they sort of came into the office one day or into my appointment and was just, listen, I saw all the questions you had and I'm just not going to be able to answer most of these. And, but maybe we can find you someone that can help you answer that stuff. And so it was a string of these things where it was just very difficult to get the testing done, to get things explained to me, that I started talking to my friends about it and to more people who were looking into improving their health. And it just seemed like a thing that everyone runs into. And it's just very, like I said, a very frustrating process. So that was the genesis of Instalab, was I wanted to make being proactive about your health as accessible and easy as possible. So that's where we started.
I think that's a universal thing because I remember when I was going to doctors, before I came to San Francisco, I was in Cyprus. And it was a universal thing. I would go with my blood biomarkers, for example, and they would never actually tell me what to do. And so it seems that the problem is global. Like, before we jump into that, like, why do you think that the doctors have that? Is it because they don't have time, or why does this problem exist?
Yeah, I think there's a set of doctors who think that doing anything outside of the norm, the standard, is considered over-testing and not necessary. But the problem is the standard is not very good. There's a reason why, the number one killer is still heart disease when it shouldn't be. It should be, way down on the list. And so I think you just have This sort of standard that doesn't make sense to be the norm. And then the other part is, especially in the U.S., we're an insurance-based business. Insurance-based system, and physicians are, they have to take in a lot of patients, and so they can't get that much time to explain things to patients. And they pretty much do a sort of one-size-fits-all approach, which obviously is not personalized at all. And so there has been a wave in recent years of so-called concierge medicine, functional medicine, in which there is a more nuanced approach to how to help you. And so, unfortunately, that comes with membership fees, or like high annual fees and stuff like that. That's not covered by insurance, but that does give the doctors time. They at least get 30 minutes, 1 hour with you to explain things to you and to really, do the research to figure out what's actually best for you in terms of testing. So I think the past maybe the past 2 or 3 years, there's been a lot of movement toward this more personalized approach and deeper testing, and people are just taking this testing in their own hands and just paying the money to do it. But hopefully, especially there's plenty of companies doing blood testing now, and my hope is that all of us will have the data to show that advanced testing early results in less deaths, results in less heart attacks, results in less everything, to get insurance companies motivated by money, by not having to do heart surgeries and all these things, to allow for this kind of proactive testing.
Got it. And then you had this idea, you validated with folks that you spoke with, that you mentioned earlier. What did you do after? Like, what was the first steps? And did you get a phlebotomy?
Funny enough, I was trying to start really small. I was like, where's my little niche corner in the world I'm going to start? And we actually started not with patients. We started with clinical labs. And so we were building software for clinical labs in the very beginning. And we figured this is a source of where the problems sort of begin, which is everyone gets these lab reports, and they get even a basic lipid panel. If you explained it well to someone, they might actually do something else. Like they might actually take action. Like if you have recommendations or explain the results in a better way, maybe they would be more proactive about it. So we were building software for labs to output a better report, essentially. And we had about 3 labs really interested. We had set up contracts with them and blah, 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 blah. It turns out not a good business to sell software to clinical labs. Then we started going up the chain. We're like, okay, let's talk to physicians now. Maybe there's software and reporting and stuff we can sell to doctors. Also didn't have very much success from there. And so we said, okay, forget all of this. We're just going to start from scratch, and we're going to go directly to the people who are most incentivized to get the testing and to make the changes, which is the patients. And so that's basically where version of Instalab today is where we started. Is we decided just to go straight to the patients. And then from there, like I said, I had many conversations about this whole entire problem with folks. And so our initial customers were just friends of mine who just roll up their sleeve. We hired a phlebotomist. We actually started in New York City and found friends in New York City who were willing to start with us. And then from there, we hired a phlebotomist in San Francisco, and so on and so forth. And right now we're almost like a referral-based product, in the sense that people find out about us through a friend, essentially. And so that's how we've gone around so far.
And you hire that first person that is taking blood from patients. Where did you focus at the very beginning? Like, did you focus on one specific biomarker or many biomarkers, or how did you approach that?
We focused initially on a cardio panel. So we actually have in-house a lipidologist alongside longevity medicine physicians. But we started with the number one issue in America, which is heart disease. And so we started with that. And then I think selling that, especially to the crowd we're selling it to, 20 to 40-year-olds, was a little bit hard, because most people don't think about heart disease young. And so we expanded our panel to include more things that people were interested in. So now we have this overall longevity panel, which is basically a good screening to do once or twice a year to understand where your overall health is. And then, you can find areas that you need to work on and just dive into there.
Why heart disease at the beginning? But was it because it's a big market, or why did you choose it?
I just think it's just, like I said, is the number one killer: heart attack, strokes, heart disease, and it's the most it's just frustrating. It's the most preventable disease also that's high on the list. Cancers and other things, it's like you could do early screenings and stuff like that. Heart disease is just get it, understand where you are, and there are clear pathways to reduce your risk. And so we felt that was a big, there was a big market there just to tackle in itself.
Got it. And what for heart disease specifically, what kind of biomarkers are you mentioning?
So there's obviously the standard stuff, which is the lipid panel. Then there are these markers that are getting more popular. So there's ApoB, which is a better predictor of risk than LDL cholesterol, which has been used for years. There's Lp(a), which is a genetically determined biomarker. There is we do an ApoE genotype, which is, most people know it as the marker for dementia, for your risk for dementia, late onset dementia. But it's also a marker for risk for heart disease related to cholesterol. And then there's a set of markers, so very related to heart disease, is glucose metabolism and metabolic health. And so we do insulin and glucose, fasting insulin and glucose. We measure your insulin resistance. And then from there are these secondary cardiovascular markers that are related. So you've got homocysteine, which is then impacted by B9, vitamins B9 and B12. You've got your uric acid, and you've got these other inflammation markers like ferritin. And then down the chain, you go to your complete blood count, and then also we take, at the appointments, we take blood pressure and blood pressure, BMI, and those two. So
Got
I
it.
would say
And then
that, yeah. So go ahead.
so basically what happens is that all these values are very high, and your goal is to help the user to optimize them and drop them lower, or how are you helping?
Yeah. First, we're trying to get a baseline. Where are you at? And then it's funny because our panel has over 50 markers, and you could have a lot of red, but really, and if you see a lab report, it's all red, you might freak out. It's like, oh my God, where do I even start? But in reality, most people, you can group all of them together. So for us, our patients are either they need help in cardiovascular health with lipids, and homocysteine and all that stuff is related to it, or they have metabolic health issues, so insulin resistance or blood pressure. Those are the top three things, and I think that's like common across America, not just our patients. But yeah, so what we try to do is we try to identify what's the one thing you should focus on now, and then what are the 2 to 3 things you can do right now to optimize those values to de-risk yourself from those chronic conditions. And like I said, most of the time it's just, it's like 2 or 3 diet changes, maybe some supplementation. And then if, some people like myself, I have genetic condition that causes my triglycerides to be high despite all the diet changes I make. And so you just need supplementation or medication to help bring that down. And the overall, the idea is to group the biomarkers together and identify 2 or 3 things to bring them all down at once.
Got it. So I think the very big problem here is the recommendation. As long as you can help the patients understand, or the users understand what they need to be doing, it's the key. But the problem is, like, there is some sort of a fine line in the type of recommendations that you can make, and what's considered legal and illegal, especially in the US. How do you tackle that? Do you have a doctor that gives these recommendations, or how do you do that?
Yeah, so we are actually a medical practice. So we have physicians who review everything. By and large, most people have similar issues, and the recommendations based on their diet or what they're currently doing, you'll need to personalize that. But the first set of recommendations you go out are pretty standard. And we do a pretty good job trying to explain why specifically you should do this sort of thing. And then when we do follow-ups and stuff like that, we try to understand what changes they've made, and then we go further down the path of personalizing recommendations and adjusting the things like dosage, or you might have changed your diet or something like this. But anyway, to answer your question, we do have physicians review each report and look at specifically. Also these days, it's to look at edge cases in particular, because those are the things that our software won't pick up right now. Obviously, by definition, it's an edge case.
Yeah. You spoke about longevity a bit earlier. How can you help someone live longer?
Yeah, so I think there's two types of companies in longevity, and we fit in clearly in one. So we're not the biotechy kind with new medicines and new tests and all that. Like, that's awesome, but that's not our bread and butter. What we are is we're trying to increase your lifespan, increase your health span by de-risking, lowering your risk for chronic conditions as much as possible. So like heart disease, insulin resistance, dementia, and cancer. And then on top of that, and a lot of those things, unfortunately, are hidden risks. So obviously weight is one thing you can, like obesity is one thing that's comorbidity for a lot of things that if you reduce it, then you probably reduce your risk. But things like lipids and stuff like that, it's very hard to, you can't feel it, like you can't see it or feel it. And so you need to do that blood testing. And then the other part of what we do, aside from lowering your risks, is trying to get you an optimal state of well-being, physical and mental. And so that's, I would say that's more subjective than objective. I would say the biomarkers and the testing are more objective, and are easier to help you with than something like reducing your stress or things like that.
Mm-hmm. Also, at the end, like if you consider 5 years down the line, how much technology do you think that you can embed here versus having more physicians doing that fun?
I think we've got a long ways to go with building out the software. I think especially with how good the machine learning has gotten, the prediction of risk and the output of specific super personalized recommendations based on research and your own data and what else exists out there and layering in some physician input is going to be as like nowhere close to where it can be, and I think has amazing potential down the road, in which I don't think this requires hundreds of physicians. I think this requires 2 or 3 physicians. And obviously, if you're going to do, we always want a physician right now to reviewing everything. But and also my understanding is you need to get FDA approval if you're just going to become like an AI doctor or something like this. But that's the dream, right? Is to become that AI doctor, and because what that means is right now we still are, in my opinion, expensive for a lot of people, and that's because we need to have the physicians on board. We need to have the team on board to do all the work. But a true AI doctor would mean the cost is virtually, very close. It could be as close to zero as possible, and which would mean that what we provide can be provided to, many more people.
Why did you choose the approach of sending a phlebotomist to someone's place? For example, I've seen other companies they send you finger testing. This. What do you think?
Well, finger pricks are, so I don't like finger pricks myself, and I am not going to put that, like I don't do it myself because it hurts too much and it involves too many of my fingers to get the blood out. And then there's some kind of error rate. That being said, those finger pricks tests are good and they're well validated. But what I would say is our panel right now cannot be done through a finger prick because there's too many markers. We are doing some smaller panels, but we've resorted to using a device called Tasso. I don't know if you've heard of it, but essentially it's like a device you put on your arm, kind of like a CGM, but hurts even less. And you just kind of click it, and the blood comes out from your arm here. And because there's less nerves here, I think it's not painful at all. Whereas the finger prick is extremely painful because you got a lot of nerve endings here. But maybe more answering your question, we do a smaller panels, but for the bigger panel, the reason why we sent phlebotomists is because the number one thing I heard people say is, I don't have time to go to I don't want to wait in the waiting room. I don't want to go to a LabCorp request and, take the time to do that. And so, especially with people working at home a lot and stuff like that, just want to swing by 15 minutes, removes the barriers of actually getting the test done a lot. That being said, in the future, it is puts a high expense to the testing, and so for people who want cheaper testing, we'll probably places where you can go to, like a lab visit, and hopefully we can make that experience much. the existing experience.
Got it. You mentioned that device that you put on your arm and extracts blood. I didn't actually know that it's a thing. I didn't know that it's
It's
working.
amazing. Yeah, this
Wow.
I've heard about 10 years ago when they started. And it's now coming onto market and it's been clinically validated for diagnostic testing,
Wow.
which was not the case a few years ago. Yeah.
And how much blood does it extract though? Like, is this meaningful?
Yeah, it can I don't know, I think it's 250 or 500 about. It can do up to, I believe. So we have a current panel right now that does ApoB, lipid panel, direct LDL, ApoB, and ALT, and we give this panel to people who are taking cholesterol medication. So when we prescribe cholesterol medication to our patients, we ask them to test every 6 weeks just to make sure that the dosage is right, the actual medication is right. So we just send it to them. And so that's like 7 markers. Yeah, that's 7 markers. I think it can get up to 10 to 12 depending on the test you do. And it's not validated for a lot of tests right now, but it's a pretty big menu of tests. Like if you want to do a fertility panel, like you're trying to get pregnant or something, then you can do it. You can do that panel on this Tasso as well.
Interesting. You mentioned why is that? Like, do you encourage it in a way, or how does it work?
I think it's a combination of we haven't spent a lot of time on top like paid marketing or any like social media or that kind of thing because we have enough customers coming in the door now where we can really get the product good. And so I think the thing I learned, it's funny because I kind of am like reversing what the typical stereotypical founder does first time and second time. But I think the first time I did my startup, I spent way too much time on growth. And just there was an imbalance between growth and making a really great product experience. And so this time around, I'm trying to balance it out a bit better.
Mm,
And so that's why we're getting enough patients right now in the door through organic traffic, through referrals, that we feel satisfied enough for now to allow us to continue building our product. We are going to get to a point where we should, put more people down the funnel, and at that point we'll be at the point where we think the product is good enough to scale rapidly, and we're almost there. It's just it's funny because it's not, last startup was cleaning, which is actually hard because every home is different and people's definitions of cleans are very different, but this is like another level. This is people's health. We got to make sure everything is really crisp and clean before we really try to make that rapid growth a
mm.
goal of ours.
And why the focus on founders?
My bread and butter. It's my mission now. In the beginning, actually, beyond my own friends and their friends and so on and so forth and their family members, I made a goal to talk to at least one founder a day. Whether it's I could help them with their company and whatnot, but then also just like trying to reset everyone to thinking. I think people, especially from my first stop, where it's just like you just think, I know my health is really shitty right now and I'm doing disservice to myself, but like when I'm successful, then I'm going to be healthy. But that success is always a moving goalpost, and so you just damage yourself essentially. And that's what I did for 6-7 years. I just like damaged myself, and I'm now just close to reversing that damage. And so I have it a mission now, like I said, to just get founders to prioritize their health. And I sort of have the mantra. I'm like, you don't need to spend even 10 extra minutes out of your day to focus on this. It's just understanding where you're at now and then making those tweaks in your lifestyle to make sure you're not going in the wrong direction. Because you don't, especially for an older founder like myself at this point, you don't, you can't get on that pathway of damaging yourself.
Mm,
It's bad for business too. It's bad for startup. It's for your startup.
yeah. How are you thinking about fundraising after, like, you raise a lot of money from Homejoy and then you got all that experience from YC? How are you thinking about
Yeah.
fundraising now? Are you changing your approach and how you think?
It's funny. I don't know if this will remain true or not, but I've decided never to announce fundraising ever again, or announce when I have it, because it just brings all sorts of people and troubles, honestly, from just announcing it. It's good for recruiting, but that being said, I right now want to build a forever business, and I want a business model that works in itself and not dependent on, VC money. That being said, I'm not opposed to VC capital if it can help growth, but I want to make sure before I do that I've got a business model that if that all disappears one day, then it'll still be functioning. And it's just a lot of people rely on us now for testing and for their health. And so I think it's very important that we actually, for their sake, make this business model work so that it can exist forever.
Mm. Can we speak a bit more about what you mentioned earlier? What do you mean by like if you do a big announcement of VC funding, for example, like what negative things does it bring you?
Okay. I think it just brings attention, and VC funding it's successful in the sense that you've convinced a bunch of investors to give you money, but it's not correlated with actual product success or any sort of success for your company. And then it just brings you attention, and I sort of just don't like that attention. I'm very different from a lot of people. So this is not I'm not saying this is the game plan for everyone, but for me, it's just I want to focus on my product and I want to focus on our users, and not all the shiny other stuff. And so that's just sort of my personality, to be like that. But like I said, I'm not. If we raise a big round and we need help with recruiting, the one thing that helps get you attention is a big funding announcement.
Interesting. If we get a bit into YC, you spent a number of years there being a partner. I'm interested to hear, like, how did your worldview change when building a business after you work with so many startups?
So at YC, it has gone bigger these days. And so you see as a partner there's more volume of founders that come in the door. And so you see the diversity of founders that come in the door is very large. And so as a result, especially as YC has grown older over the years, you see many more successful types of founders. And so I think when I started at YC, I sort of had a sense from talking to my own friends who were very successful on this is how you start, and the personality that's required to do this, and the blah 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 blah. This is sort of like the roadmap. You can have slight deviations from that roadmap, but this is sort of the roadmap of how a successful startup goes. But yeah, working at YC, you see, like I said, so many people succeed in so many different ways that you tend to be less judgy of the way people start, their personalities, and so on. And so you more look at what habits do they have, how obsessive they are about talking to users and working smart. And not breaking down when bad things happen, and focus, having that right balance of growth and product experience that I was talking about before. And I think that's where, and today, there are companies out of the blue. I'm so far away from in the vesting world these days, but out of the blue in the headline, sometimes I'll see a startup that was in the batch that I was in. I was like, oh my God, that's amazing. Had no clue they were doing well. And so it's just like you never know in this world. And yeah, so that's what I would say. I was, to be more succinct, just less judgy about people and how they can be successful.
Are there patterns that you see now that if you repetitively do them are going to make it easier for you to succeed? I think you inferred a bit about speaking to users. How much should one speak to users? And maybe, is there too much, or can it never be too much?
There's too much if you are taking everything people say at its word, and not doing the proper analysis. I don't think it's ever too much. Obviously, you need to work smart and spend, split your days efficiently so that you're actually making progress in the product. I do think, like, especially if you're looking for some specific feedback on a specific product feature, after talking to 6 or 7 people, you sort of get the gist of where people at, and there's diminishing returns on that. And so, yes, I think that because there's diminishing returns, it's not smart to be spending 100% of your time talking to users. But by and large, what I've noticed is that founders tend to not really talk to any users, or just to talk to like one every 2 weeks. And I think that's the side of the spectrum I wish to push people into. And it's hard, right? Especially starting a new product. It's like, where are these users I'm going to even talk to? And so you just have to get out there and do the cold calls if you have to, show up to events if you have to, or if your users could be there. But yeah, so I think there's a balance, but I think by and large, most people are not doing enough.
Mm. And then by other partners, like do you reckon, like aside of speaking to users, what other partners do you see that you are really doing in Instalab now and that are really helpful?
Good question. I've said this a lot on it's how people react. It's the reaction of a founder to a certain situation, good and bad. I feel like good founders are just really sort of chill might be the wrong word, but when something bad happens, they tend to just take it all in. Maybe they get upset for a little bit, but not too long, like no more than 10 minutes. And they figure out immediately what is the thing I need to learn from this. And then they move on and they don't let it drag and they don't go to their co-founder um, or employees or whoever it is around them and just like kind of drag it out. Just like you just make quick, decisive decisions and continue going on and not let it get to you. And I think that's table stakes. I used to think like that's just like one sufficient trait, but I think that's actually a necessary trait of a good founder at this point, because every day things good and bad, and like I said, and you can't if like four bad things happen and only two good things happen, it can't be that day you were set backwards. Every day you got to keep moving forward.
So basically, it's the ability of the founder to get over an issue very, very fast.
Yeah, and make quick decisions. I mean, make smart, quick decisions, but don't prolong things over time.
And then if we go back to Instalab, like what's from now onwards? What are you doing from the perspective of the product first? Are you adding more blood analysis or more categories of products, let's say? How are you tackling that?
Yeah, the way we see ourselves is we want to be a healthcare solution for people who are interested in being proactive about their health, which means eventually we're adding more products and services. We are trying to close the loop in the sense that we started off with blood testing, and then people were like, well, can I also talk to physicians? So we added on physicians. And then after that, people were then sort of, oops, I believe we're having a connection issue here. Oh, here we go. Sorry, I lost you there for a minute. Sorry, I'll start from the top. So essentially, we started with blood testing, and then we've added on physician services, so you can talk with a longevity physician or a lipidologist or someone, if you're someone, some sort of specialist will connect you to one. And then now we're closing the loop by offering treatments, which is something that a lot of our patients are telling us is like, can you just give me this medication or this supplement or whatnot? So we started with, as I mentioned earlier, cholesterol medications is the top issue for people when getting down their ApoB and LDL cholesterol levels. There are a lot of cholesterol medications out there, so it's actually most doctors will just give you a statin and then just you're on your way. But people are intolerant to statins, and maybe that's not the best medication for you to start with. And so we have this test and treat approach. So everything comes back to testing, though. So we give you a statin, we make sure you test every 6 weeks, readjust, and keep going down that path. And so we'll do that approach for other sorts of supplements and medications as well. But we're starting with lipids. But yeah, by and large, like I said, I really want to be the place where if you want to be proactive for your health, you come to Instalab and you can get it super easy. You don't have to go fight with your doctor about just wanting to be healthy and understanding this stuff.
What are your thoughts about sensors in general that measure real-time data? For example, if we get CGM devices that can see your glucose 24/7, every minute or every 5 minutes. Also, like I've seen an announcement today, Dexcom with an FDA approval of them.
Yes.
That's pretty interesting. So how are you thinking about them?
So a lot of patients use, not a lot, but a good bit use CGMs, and it's really good to understand where you're at. I mean, obviously people need it to use it if they have diabetes and stuff like that, but for people who are just optimizing their health and their diet, it's a good way to learn about your foods, and about where you're at or how things change based off of your exercise patterns and things like that. So I think some people wear and they don't really look at it, and so I don't like they're just doing it out of habit, and I'm not sure what the point of that is. But I do think people who are extremely focused on optimizing their diet and exercise, like it's a great tool. And I'm so excited this is going to be you don't need a physician to get it. I think lab testing in general, you shouldn't have a physician um, to get a lab order. It's just so weird to me that that still exists. But hopefully, a lot of these DTC testings have layered set up in a way that you don't even see a physician, but there's still a physician in the middle that's writing an order for you to get the lab test. But some of these home test kits, you don't need a physician lab order anymore, even in the back. And so hopefully the US becomes more and more, has a more approachable way of getting testing to people.
Mhm. What technologies from these are you excited about? Any kind of wearable or like sleep mattress like 8 Sleep, or what are you using personally?
I use an 8 Sleep, love it. I need my cool temp bed in the mornings, and my sleep I'm actually pretty good at sleep now. I used to have insomnia, but 68 degrees, got my 8 Sleep mattress going, and no devices before bed, and that works wonders. Turns out sleep, I think, for most people, if you get the temperature right and you take the device away, it's actually like pretty easy to fix. In terms of other test tools I'm excited about, I mean, obviously, I do my Instalab panel every 3 months. I've had to do a little bit of genetic testing because after diet and exercise, I couldn't get some values down. But I don't wear any wearables these days. For a while, I had high blood pressure, so I got one of those continuous blood pressure wisps. They're actually available in the Europe. I don't think they're available in the US
Yeah.
quite yet. But I mean, they're not. I don't wear it anymore because I have perfectly fine blood pressure, and it's kind of useless to look at. But one of the things that does exist is when you go to doctor's office, even or phlebotomist, when they take the blood pressure, there's something called white coat hypertension, which is you specifically get high blood pressure when a medical professional is taking it. But if you sit by yourself in your own room, you have perfectly fine blood pressure. And so if you do go to doctors and you get high blood pressure, and we tell this to our patients who get high blood pressure during the appointment, is like you need to just get a monitor and just make sure you don't actually have high blood pressure. If you do, then obviously that's something to focus on fixing. And so that's why I was worrying about it, because it gives you it's taking a reading, like, I don't know, every minute or every few seconds or something. And so it gives me in like where I'm actually at, versus just a one-time reading. Let's see, other stuff. I mean, there are other things beyond blood tests that I think are going to be game changers. So the full body MRIs scans, the Pernuvos, and there's a few other companies doing it. They're really, the price is super inaccessible right now. So hopefully either insurance will cover it at some point, and the prices will come down. But after you take that scan and you see the report, you just feel, and nothing comes up, you feel pretty good about yourself, about your health. And I think if you can afford it doing that, I would highly recommend. Yeah, and there are a lot of like early cancer detection. Like we offer the Galleria test, has a has a pretty good specificity rate to it. So which meaning like if it comes back positive cancer signal, you likely have something going on versus you're just going to go down like a rabbit hole of nothingness. But in terms of early cancer detection, it's a little bit questionable, but it's still better than existing things. And so that test I recommend. But also, unfortunately, expensive. You can get it for like 800, like $900 per draw. I think these are the Pernuvas, Gallerias, these things, just trying to get in front of cancer as early as possible are going to be game changers. I personally believe in, like with heart disease, a lot of it has to do with diet and exercise, and that is very hard to get people to change. And so TBD on whether heart disease can go down as the number one killer. But that being said, there are a lot of these startups, including ourselves, that are trying to get in front of it and making people more aware early when it's super easy to make those changes. And so I'm super optimistic we can make that number one to at least number two or three or four at some point in the near future. In which case, then the next thing would be things like cancer and dementia and all these things. And so um, the things to prevent it and the things to detect it are a whole lot further away than heart disease. And so when I see new things come out from that field, I'm pretty excited about it.
In terms of, I wanted to ask you a bit about company culture, your thoughts
Mhm.
about culture in general. How many people are you today, and how are you thinking about
We're actually just 5 people.
it?
And I don't like growing big companies. I don't like I don't think adding people unless you really need that person, you can't do the job anymore yourself, is necessary at the stage we're at. Obviously, Tara, your company is much bigger than ours, and you have a lot more customers and stuff like that. So you need the people to support it. But for me, I'm still in the mode of as the founder of the company. There's two founders, there's two of us. Um, every job we do ourselves, and then if we don't have time for it, or if we can get someone who can do it much better than us, then we go hire that person. So obviously, the people we actually need to hire are physicians, because we're not MDs ourselves. Um,
Yep.
and then we've hired phlebotomists, of course. I actually try to be a phlebotomist, and I'm not very good at it. And so I really wanted to be our first phlebotomist, and I went to school, and me and the needles it's actually less about the needles and more about your sense of touch and your ability to
Yep.
find the vein with your fingers. And I just don't have that touch. But yeah, that's the way I think about scaling companies. Unless you need it, don't hire it.
Yep.
And for me, like, I do all the customer support right now, and it doesn't. I'm not scaled out of that quite yet. But maybe in the future, I need someone to bring on to do that. But just a wait and see game at this point.
Yeah. How do you hire someone for a role that you don't understand yourself?
Oof. Yeah, I think that's the thing part where I think you have to just try to do it yourself. And if it's something you can't do, like, obviously I'm not going to go through 4 years of medical school and 4 years of residency training or whatever it takes to understand being a doctor at this point in my career. But you can put people around you who are who are great physicians, who have hired great physicians, and suck as much knowledge from them. And then on top of that, before you hire that person, is put those people in front of that person to make sure that they get a good feel of that they can do the job that they're personally doing. And I think that's the way to go about doing that.
Mhm. And then in terms of, like you mentioned, that you're three that you hired, like, did you
Mhm.
look at specific characteristics? What can other founders learn from your approach in terms of how do you how do you make sure that it's the right person? And then
Yeah,
also, how do you find them?
yeah, that's a good question. So I should say we have 5 full-time, but we have a lot of part-time folks that work with us. We usually I first look for ambition, and are they ambitious, and are they a hard worker, and can they communicate well with me in particular? And after that, I don't try to honestly dig too, like, I don't we don't make people take tests. We don't do all these things. I just want, like, the ultimate test is just working with us. And so we're small enough now where this still works. I don't, it gets harder when you get a little bit bigger, but put someone on a 2 week, or if it takes, if the type of work you need 1 month, then put them on a 1 month contract, pay them what they deserve
Mm.
to work with you, and then go through the motions. And sometimes it works and sometimes it doesn't, but that gives you a really good feel of whether they're a good culture fit, and yeah, whether they're right for the company or not.
Tell that someone is extremely ambitious from an interview. Like, what would you ask them?
um it's basically what they've done in the past, and what have they done on their own in the past. So if you're talking to a college student, there's not much history there, but if they can talk about the projects that they've done outside of the standard fare college student, that's one indicator. And if they're older, then you can maybe talk about the things they've done at work that are outside of the standard fare, or what are hobbies and other things they've done. It's like at YC we have this one question on the application. I'm sure you remember. It's what was the question? Crap, I'm forgetting.
What's something? What a system you hacked, or maybe what's something?
Yes,
Is
yeah,
it
sorry. Yeah, the
vision?
hacking question. Yeah, there's a question that tries strikes at a vision, and there are people who are like, in 7 days, walked across Antarctica. No one actually did that, but, like, things like that, something like way out in the extreme, where it really took a lot of effort on their part, and not many people are telling them, by their side, helping them out, or some kind of struggle they had in the past that they've overcome. Those are the things that you sort of look for.
Awesome. Adora, my last question is, if you look backwards, if we're 100 years into the future and we look backwards, what things
Yeah.
do you think are going to be totally wrong in the healthcare space, and we'd be looking with a bit weird, and we are going to say that was really stupid?
That's a good question. The whole insurance system is probably where I would put it. It's well known how backwards and awful it is already, but there must be a better way. I don't know what that better way is. I mean, our way of tackling it is, self-pay, and trying to get the cost down and being efficient with what we do to get the cost down on behalf of our patients. But I think we're going to look back on insurance and just think, what the hell we were thinking there, getting all those incentives out of line to the point where people weren't getting the care they needed. It's just so it's just so bad. And on top of that, it's also, why did it take us this long for people to get all this preventative care done, preventative testing done? That would be the number one thing. I think that's going to be the most recent thing. Even I think insurance is going to accept preventative testing, more advanced preventative testing, very much more before the whole insurance system breaks down itself. Yeah, PG has an essay. I forget what it's called, but part of the essay was sort of talking through things that we were going to think that were really dumb that we did. And one of the things he mentions is frequent diagnostic testing. And it's just weird. There are reasons why, testing your blood every single day is not the best thing to do. You're just going to get like all these variations and it's not going to be very helpful. But, getting this test twice a year, 3 times a year, it's sort of frowned upon by a lot of people, but it is what's getting people ahead of their health. Yeah, this is I think this is the future, and people need to, I have this the whole long dramatic speech about this, which I will prevent myself from going through. But one of the main reasons that people don't want this testing done is because, or they want the physician involved all the time in the testing, is because when the test results come back, maybe they are bad, and the patient might just freak out or misunderstand it or something. And so that's why some people think that people shouldn't get this testing done. And to that, I say, it is on us as product builders, as physicians, or whoever, to be explaining these results in a way where a patient doesn't end up in that scenario. And so that is where we think we're going to come into play.
Super. Adora, thank you so much for the discussion.
Yeah, this is great fun. Thank you so much.